Periodically on this fine radio program, we like to bring you up to date on some folks who are making a difference in the world around them. We have on the KSCO Live line with us Teresa Bartels, the president of Gateway for Cancer Research, a leading nonprofit organization committed to funding cancer research, breakthrough cancer research, through the University of California, San Francisco. This is a 501c3. Let's bring Teresa on. First of all, good morning. Thanks for joining us.
Good morning, Bill. It's great to be with you this morning.
Now, this organization is helping to bring cancer research forward. It's unique, however. We'll talk about that in just a moment. But first, tell me about Gateway for Cancer Research.
Gateway for Cancer Research is an organization that funds early phase clinical trials. So phase 1 and 2 is when dosage and safety are proven in real people. It's oftentimes when ideas that start in the lab are first tried in people who may have no other options. And you have to get through those early phase trials to get them to a place where, for example, pharma or other biotechs would be interested in taking it further for commercial purposes.
Now, your organization, Gateway, is unique, I guess, because there's several different things about this organization that kind of stand out, at least of lay people like me. Patients have a voice.
Absolutely. We're very concerned about making sure that patients are at the center of everything that we do. So we actually measure the quality of life as reported by patients while they're participating in clinical trials that we fund. Mm-hmm. We ask them also to tell us the kinds of things that they're interested in and the kinds of trials that are most needed. And we're constantly measuring and providing reports to our donors about the impact that Gateway is making. Currently, we're funding 55 different kinds of clinical trials at all the major cancer centers throughout the United States and in 5 countries outside of the U.S.
Yeah, you know what strikes me is a lot of times you hear about cancer research and you realize it's in many cases is kind of broad-based. It's sort of trying to do as much research as they can. Gateway invests in targeted things.
Absolutely. One of the things that's really changed a lot in cancer research in the last 5 to 10 years due to genomic sequencing and the ability to really look at the cellular level at what's going on with cancer mutations. And we really try to find research that is taking that into account so that for each person, cancer is going to be different. And we know now that cancer isn't just one disease. It's really at least 200 different diseases, and it's going to be differently expressed in each person. So you need to be very customized, very personalized in the way that a person is treated.
You know, in reading some of the research that's going on, some of the targeted research we just spoke about, there's a couple of really interesting ones here. I like the whole idea of tumor paint. This is explain that. This is amazing.
Yeah, it really is, and it's very touching. Tumor paint is our kind of slang word for something that's quite amazing. At Seattle Children's Hospital, we're funding research where they're using a chemical that is given to children prior to surgery for brain cancer. And you can imagine that when you're doing surgery to remove a brain tumor, you want to be extremely precise. And so this tumor paint actually acts like a molecular flashlight. When the surgeon is looking at the tumor, it can look very similar to brain tissue. But tumor paint actually fluoresces the tumor, the cancer cells, so that they can find even microscopic particles of cancer and remove those, and only the cancer cells. so that they're not only saving lives, but saving children's abilities.
Yeah, they're saving brain
And
tissue.
it's just remarkable. Exactly.
Yeah,
Exactly.
I just wanted to point this out as one of the many things you're funding through this because it's so fascinating and so cutting edge. Let me talk about you're in the San Francisco Bay Area today for a special event. Tell me about that.
We are. The 5th annual Michael Brannon Memorial Golf Tournament is being held today at Los Altos Golf and Country Club. It's benefiting Gateway and in memory of Michael Brannon, who was a tremendous golfer. Michael was diagnosed with kidney cancer in May of 2011. He continued playing amateur golf and actually won the NCGA Senior Championship in 2012. And this particular event is put on by his wife, Shelley, and two of his sons, his two sons, Kyle, who lives in Cameron Park, and Chase of San Francisco.
Wow, this is a great event. And, of course, it's helping you folks fund your many projects as well. So it's kind of
Absolutely.
a win-win for everybody.
And they'll top $100,000 today, and that really helps us a great deal in funding the research that we fund.
Well, I can't thank you enough for the information and for the work you folks are doing. We all are touched, unfortunately, these days. We all know somebody who has cancer or who had cancer or who's in remission or some aspect of cancer. It's so widespread that it's sort of like 7 degrees of Kevin Bacon. You know, everybody knows somebody with cancer. And I wish that wasn't the case. I hope someday we don't have to have a conversation like this on the radio.
Well, I think people should know that because of research, 2/3 of the people diagnosed this year can expect to survive. So the kinds of things that we're funding really do make a difference. They can go to our website at gatewaycr.org and find out more. We'd love to give them more information, and certainly we'd love to have people donate so that we can continue to fund really breakthrough research that makes a difference. The kinds of research that we're funding, because we have an underwriting for our expenses, 99 cents of every dollar that we raise goes directly to research. So it's extremely efficient as well.
And that's your funding. Remember now, every Gateway dollar goes to fund directly phase 1 and phase 2 clinical trials, which is, you can't, every cancer funding organization can't say this. You're specifically targeting these aspects of the research.
Absolutely. It's an extraordinarily unique approach, and we're very fortunate to have the underwriting that makes that possible.
Once again, please, Teresa, if you would, could you give us the website so folks can find out more about how to, fund this, how to help?
With pleasure. It is gatewaycr.org.
Oh, that's easy to remember, isn't it?
It is.
Teresa Hall Bartels is president of Gateway for Cancer Research. It's a leading nonprofit organization. It's a 501c3. And as you've heard this morning, they directly fund phase 1 and phase 2 clinical trials. Thank you so much for joining us. We really appreciate the information.
Thank you for having us, Bill. Take care.
You too.